People are losing everything at the poorer end.
The large part of earnings decline is coming because of an employment loss. We've just gone out of the labor market, we are earning nothing now, and hence there's an employment loss.
So can we think of creating a wider net beyond Jandhan, which will reach much more people?
I'm sure the policymakers are listening to this. Hello, everyone. Welcome to this interesting talk at the Business Standard that we are having with Mr. Amit Basole, who is the Assistant Professor of Economics at Azim Premji University, and Rosa Abraham, who is the Senior Research Fellow at the Center for Sustainable Employment. Azim Premji University has come out with a very exhaustive report on the state of work in India. It is the third report in their series, a successive year when they have come out with the report. It has in it all the insights about the impact of COVID-19 on incomes of people, on their livelihoods. The report also shows that people have reduced their food intake during the pandemic. The economic crisis was so humongous that they had to resort to these things as well. To talk about all the details, all the findings that Amit and Rosa and their team have found out from the analysis of data, we have invited Amit and Rosa to this talk. So welcome Amit and Rosa to this talk, and I kick off the talk by asking you a question on the income impact of the economic crisis and the public health crisis that we went through last year. What are the very brief findings and what can you say about how COVID-19 impacted people's incomes in 2020?
During the lockdown last year, there was a huge shock to employment because millions of people suddenly were out of work, which then recovered after the lockdown was lifted. So the employment started coming back. But one of the main findings in our report is that the recovery of incomes has been much weaker than the recovery of employment. So even when people have found work subsequent to the lockdown, the kind of work that they have found was not as remunerative. Either they went back to the same work and were being paid less, or they found other work which was not paying as much, and so forth. So broadly, what we find is at the household level. So we have looked at two different kinds of incomes in the report. One is CMI gives you data on household incomes from all kinds of sources. So of course, labor is the biggest source, but there could be some other sources also that households have. So one is household income and the other is labor incomes, which means earnings of workers. We have looked at both. What we find is that if we look at the period between March and October, we only had data till October. That was the last data point at the time of writing the report. This whole 8-month period, there's a huge decline in incomes compared to the preceding 8-month period. So in the report, we have detailed numbers by household deciles, like what point in the distribution are they, the poorest 10% to the richest 10% of households. How much is their COVID 8-month income lower than their pre-COVID income for a similar period of time, right? And the headline kind of number that we wanted to highlight was that this shock of decline, the decline is much larger in proportionate terms for poorer households. And we calculate that in absolute terms, something like 15,700 rupees of income were lost by the poorest 10%. Okay, and that's a large number for them because that's more than 2 months of income for this group of households. Right?
So basically, they lost more than 2 months of income in 8 months.
In 8 months, completely was wiped out, and most of that is coming from the lockdown period. So, so if you focus in on the trend, we have a event study analysis that we do, which we say, okay, with respect to a pre-pandemic reference point, in every month of the pandemic, what was the income like? And we show that April and May were the worst months, as you would expect. So households and the bottom 20% earned nothing at all. 100% of their earnings were wiped out in these 2 months. And then it recovered in June and so forth. For the richest, the shock is much less. I should say that everybody's earnings suffered. So in the CMI data, pretty much across the income distribution, there is a decline in earnings. But at the upper end of the distribution, it's only about less than a 25% decline, while it is 100% decline in the bottom end. People are losing everything at the poorer end. So that's at the household level picture of incomes. Rosa can come in with the correction to labor and employment.
Sure.
Right. So, as Amit said, when during this period, what we see is that there's an employment recovery of sort. So, most people who were employed previously are able to come back into work, and the workforce participation rate has kind of restored. But what we wanted to look at was what does this mean in terms of labor earnings? So, you can have labor earnings go completely to zero because you've lost your job, but you can also have your earnings fall because either as a daily wage worker, for example, you're just working fewer hours now, there's not enough demand, or
Mm,
as a self-employed shopkeeper, for instance, you just don't have enough customers coming in,
mm,
or as a factory owner, you don't have enough orders coming in. So in that sense, the earnings at that level, even for an employed person, can fall. So we tried to see where this income decline was coming from for different kinds of workers. And what we found is that for, say, the formal salaried worker, which is called permanent salaried in CMI, the large part of earnings decline is coming because of an employment loss. They've just gone out of the labor market, they're earning nothing now, and
mm,
hence there's an employment loss. So for them, the sort of policy here is bringing them back into the workforce and then thereby restoring their earnings. But for the majority of the workforce, which is our self-employed and daily wage workers, the major source of earnings loss, in fact, about 80% of earnings loss, is not because they lost their jobs, it's because what they earn now for the same work that they did or similar kinds of work is lower.
mm,
So, most of the earnings loss has come because of a genuine decline in the earnings that they are making as a worker. So,
mhm,
in that sense, what we are then saying is that even if you're working, it doesn't mean that you are back, everything is restored to normality. There's a huge income loss that is accompanied,
mhm.
even for those who've come back to work, who've remained employed through this period. And so, in that sense, what we are then advocating is this huge loss of income, which Amit talked about, which is approximately 15,000 over the course of the last 8 months, has to be made up for or supported through policy measures like a cash transfer.
Yeah, so the government did resort to cash transfers last year. The amount was small, I think, and I think the report also mentions the use of Jandan accounts for as a channel for cash transfers and the inefficiencies involved in that. So, what do you think about the quantum of support that went last year and the channel used? Should that be improved if there is some kind of support coming in this time as well?
So definitely the quantum of support at the central level has not been enough. It was in the Pradhan Mantri Garib Kalyan Yojana package of last March, it was 500 rupees over 3 months, so 1500 rupees total.
Mhm.
That was the central contribution through the Jan Dhan accounts. There were many states that did announce supplements, and in the
Mhm.
report we have gathered some of these state orders and so forth that were made to announce extra cash transfers beyond the center. We don't have much data on how many of these transfers actually happened and reached people and so forth. I have not seen any good studies on that so far. But for Jandhan, we do know that the reach was also a little problematic. As you said, first of all, other people have shown even before the crisis that Jandhan penetration among, let's say, below poverty line households and so on is not so good
Mm,
compared to, let's say, PDS. Right? So
mm,
more than 90% of households may have a ration card, but only about 50% of households have these the kind of Jandhan accounts, women-owned Jandhan accounts that were necessary for getting the cash transfer. And then conditional on having the account, it's not always certain that you will get the money. There are some direct benefit transfer issues,
mhm,
problems that are there, which again we have reviewed in the report, various work of various people, looking at what are the different stages at which the DBT process can create a problem, so that you
mhm,
don't get credited with the money that should be coming to your account. So putting all this together, there is definitely problems of coverage
mhm,
as well as the quantum was low. So what we are saying is that given the magnitude of the shock that Rosa was also mentioning, more transfers should be undertaken for sure. And we have recommended 5,000 per month for 3 months, which is 15,000, which is roughly the number that I was mentioning to you earlier as what the poor have lost.
yeah,
But also it should be carried out through more imaginative methods than just Jan accounts.
mm,
The government of India does have an apparatus to deliver payments, for example, through Narega job cards,
mhm,
or through Ujjwal type of schemes, or through the old age pension network. All of these are DBT type of things
Yeah.
where the government transfers money to somebody's account. So can we think of creating a wider net
Mhm.
beyond Jandhan, which will reach much more people
Yeah.
with a wider, bigger quantum? That's what we are saying.
These channels of transferring benefit payments, yeah, whether it is old age pension or Narega job cards, or it could be the payments that made to mothers, under some Janani Suraksha schemes or something like that. So these groups, they are not mutually exclusive, right? There will be a lot of overlap among all these groups. Uh,
Yeah.
on the other hand, we have Aadhaar, but we don't have in the Aadhaar database. I don't know. I'm not sure if we have other qualities, other fields in the Aadhaar database which tell us about the income levels or of the household or something like that. So, will this be efficient? Will this be really efficient because of these data problems?
Yeah, that's a good question. I think we have not done the work required to really think through what kind of deduplication will be needed and what kind of verification will be needed. See, some of the things we know. For example, if you target Narega holders or old age pension receivers, then you know that you are basically reaching vulnerable populations,
Yeah.
because this is a largely self-selected kind of a Narega. It's completely self-selected. Or what Tamil Nadu has done is it has done it through the ration card shop network. It did cash payments, but through PDS shops. So again, like there's a verification at the ration card level that you are piggybacking on, deliver cash. So one can think of some of these where the identification of the deserving people that you're talking about has been done through some other mechanism, either self-selection or something else. The deduplication is a serious issue. I think what is needed, and we should probably have done this in retrospect much earlier, is that we need a comprehensive plan to increase the digital reach of cash transfers, and that can have, for example, aggressive enrollment drives for Jandhan. That should have been done also, in the
Yeah. Yeah.
preceding few months, because we know that it's going to be needed. So Jandhan coverage should have been expanded a lot more, and it's still time to expand it a lot more.
Yeah.
And bring in these other things and bring in a plan to deduplicate in some way. Right? So we have a clear roadmap that by the end of 2021, we are going to double the reach of the number of vulnerable households that we can reach with cash transfers.
I think that there are a lot of possibilities on that front, because I think at the government level a lot of data is available. So I clearly think there a lot is possible in that. But I think you also mentioned a few solutions. I'm sure the policymakers are listening to this. The time that you wrote the report, I think the second wave came after that, right? Possibly, the severest part of this wave must have come after that, and till that time no one had actually anticipated that the second wave will be this severe. So now, looking at the report and looking at the reality, do you think that the support should be higher, or the impact would be more severe than we anticipated, or more than last year in some sections?
Well, like you said, in terms of the employment data from CMI, we did use it only up till December, but we also have looked at the most recent released data of CMI, which seems to suggest that as the second wave sort of set in, which is by the months of March, April, where employment recovery had kind of stagnated, it continues to stagnate for men. In fact, there's a slight decline, but an even higher decline for women. So now women were already falling out of the workforce, and between March and April, we see a further decline in women in the workforce. So just in terms of the labor market participation, there's already some grim signs there. And after April, we know that things have gotten even more stringent. So it is likely that just for employment participation, things are going to just not get any better in the nearby future. In terms of earnings, so as Amit earlier said, we are already coming on the back of households having suffered huge cumulative losses. 2 to 3 months of income has been wiped out for a household which basically don't have much savings to rely on, and they have also suffered earnings losses even when they've remained employed. So given that you have the second wave coming on the back of a completely crippled household budget, the impact is going to be far more severe. And add to that the health crisis in itself is a pretty dangerous and shocking situation that we are in. So, of course, I mean, I certainly believe that in the dimension of employment, earnings, as well as just the sheer scale of the health crisis, it's going to be far more severe than what we saw last year, and all the more reason for a far more coordinated and more balanced and larger policy outreach to support the households that have here suffered this huge loss.
Just to add to that also, Abhishek, going back to what you said about the mobility analysis, I don't know if you wanted to talk about it later or now, but just since you mentioned the second wave,
Yeah.
and since the lockdowns have started, it's true that we don't have a nationwide lockdown like we did last year, but we have most of the country under some kind of graduated either lockdown or voluntary reductions of mobility for fear of infection. So when you put all of that together, there is pretty big reduction in circulation, and demand and so forth that has happened. It may not have the same nature as last April and May, but it is there. And what we saw in the data from last year is we put together the Google mobility data, which many people have used this past year, with the CMI income data. So what you can say is that, at the state and month level, so we have data for household incomes by state by month, and then we've got the average mobility by state by month. And what you can do is just a kind of simple analysis, controlling for states, what is the average relationship between a fall in mobility and a fall in income, right? What you see is the effect is pretty strong. If mobility declines by 10%, on average income declines by 7.5%. So it's not a one for one, obviously, because many people's incomes don't depend directly on mobility, but many people's do in retail, in transport, in restaurants, many other things. So as the second wave, shuts us down, there is a direct anticipated effect we can have, and that can be used also to motivate policy, because we can, even though we don't have income data for today, we have the relationship between mobility and income from yesterday.
We have ratios.
We have those ratios, and we can say, okay, what do we anticipate? And based on that, can we do some support?
A lot of countries, I think the US is the biggest example, and many European countries as well. Last year, the cash infusion they did to each and every household was substantial. Now I think US spent more than $1 trillion just on cash infusion, I think in 2 batches. I'm not sure about the total quantum yet. But in India, the amount was very small in terms of the annual income of an average Indian, or the size of GDP. I mean, if you look at from the macro level, say we lost 24% of the economy in the first quarter of lockdown. So a fourth of the economy was chipped away. But the quantum of cash infusion, or any kind of infusion, was not that much, at least in that quarter. It came in later quarters. So this time the government has not yet come out, and we are still waiting for some announcement, because we are hearing about it, but there's no announcement yet. But apart from cash infusion, do you think there are any other policy directions, any other directions that you have or you have prescribed in the report?
The US is not actually a very good comparison point, because of it's a much richer economy with a reserve currency, and their finances are very different. But we can legitimately compare ourselves to countries like Vietnam, Indonesia, other Southeast Asian countries, and so forth. I think those are roughly the same as us in terms of GDP per capita and finances. We have a little bit maybe higher debt to GDP ratio, but not by a lot. So compared to even those countries, I think our cash response was fairly weak. So going by the comparison that you were saying, 1,500 rupees that we did by the center level is basically about 12% of GDP per capita. So GDP per capita is 13,000 rupees a month, right? So if you look at monthly GDP per capita, then that 1,500 rupees corresponds to about 12% of that. While by World Bank comparative analysis, most countries have done something like 40 to 50% of GDP per capita per month. Right? So in India's case, that would be at least 5,000 rupees of transfer total. What we have recommended is more, because we think that we should also have to make up for what we should have done earlier and then for the second wave. So adding up, we should do more. But so far, we have done much less than what even comparable developing countries have done. I think that is the important point.
Yeah, so I mean, besides cash transfers, the most obvious other intervention is extending the PDS. So we've shown that there's a complete reduction. There has been a reduction in food intake. There's been huge nutritional compromises. So the most natural answer is the extending PDS. I know that the recent PMGKY announcement has extended it, extended the sort of incremental
Yeah.
grains June,
Till June.
but that it has to go on beyond that, given that this crisis is going to last longer. And again, PDS has much higher reach, so it is a very effective intervention in that sense. Besides PDS, we also advocate for employment guarantees. So both increasing the minimum wages that the NREGA provides, as well as extending its coverage. And we are also have recommended an urban employment guarantee program.
Yeah.
And so there are obviously also concerns that, given concerns of social distancing and contagious spread, can we actually advocate these employment guarantee programs? So there are also possibilities to kind of have employment generation schemes which are also kind of addressing the urgent needs of the crisis. So for instance, you have in Kerala, you have the Kudumbashri units working together to help in the provision of PPE kits. So it both addressed an employment crisis while also addressing a shortage of supply.
Yeah.
And you other similar interventions like community kitchens, where women, especially since we see there's a huge exodus of women from the labor market, using community kitchens as a way to bring women back into employment, which can also be done even from sort of their own homes within their houses. These are the which employment can be generated while maintaining social distancing, while also addressing the needs of the crisis. So those are sort of very urgent and medium-term policy measures that can be taken now. But more in a sort of, again, medium and long term, is that what we are saying is that there has been a huge nutritional compromise. There's been also a large compromise for educational enrollments that's going to happen.
Yeah.
Households have suffered losses. So we also call for an expansion of universal basic services, basically the public provision of health and education, extending your Anganwadis, filling up vacancies, investing in our primary healthcare centers, both as a means again of employment generation, but also addressing these kind of deficits that's going to come as a result of the crisis.
We tend to think of public spending either as dole or as a sort of, somehow salaries that don't translate into much of anything else. That's the image I think that many people have. And that's why we react quite negatively to a lot of calls of public expansion, right? Either think of it as just keeping people alive or something like that, or as paying people who are not doing much. And neither of that is actually true. And most of the programs that we are talking about, like NREGA, like PDS, like Anganwadis, all of these things are things where the government spends money to create either productive assets or bolster human capital, both of which are actually growth growth imperatives. Contributors. You can't have sustainable and inclusive growth without these things. So we need to have that shift, I think. And heading into this crisis with that mindset is really harmful, because if at this point, you say, well, should we really be spending? Then I don't know when would you spend, when we are in the middle of such an enormous crisis.
Right. So you also calculated that what proportion of households went through this thing that they had to reduce their food intake, and to what extent you also found out that. So how did you arrive at these numbers?
So one of this was part of our phone surveys that we had launched at Azim Premji University, where we had collaborated with a number of civil society organizations and conducted this survey in around 12 states. And the survey was done in 2 rounds. One was in April, May, and then later on in August, if I remember correctly. So basically, during these phone surveys, we had asked households if there's been a change in the food intake. So in the first round, we asked if you reduced your food intake, and in the second round, we asked if your food intake is now back to what it was pre-lockdown. And so what we find, obviously, in the first round was that there was a huge number of households reporting a reduction in food intake, which is to be expected because we were in the depths of the crisis then. But more, notably, what we see is that even a few months later, when we went and re-interviewed them after the crisis, when employment and everything had recovered, we found that about 20% are still stating that they have not been able to come back to their pre-pandemic levels of food intake. So that's how we basically try to arrive at this observation of what was was there a compromise in food intake and to what extent.
Strange that in India, where the nutritional levels are not very great, or not at par with the global standards, a fall from that lower level is very serious.
Yes, absolutely. I mean, we're talking about a very low base here, and even there, we are seeing a fall. It is really quite, and it's going to have huge nutritional deficiencies. I mean, the last NFHS round also shows that we are suffering from huge levels of stunting and so on. So,
Yeah, yeah.
add that this crisis, it's just going to be completely disastrous.
So just to add two brief points to that, with respect to food security, of course, the lack of fallback is what really stood out, right? So not only in our surveys, but also more importantly in other surveys. For example, the Hunger Watch survey that was carried out in October, and then they did a second round right now. The report just came out of the second round. What you see is that there are certain combination of factors among the urban poor that really enhance the food insecurity. Then in urban areas, PDS works less well compared to rural areas, and in urban areas you don't have the fallback of agriculture. Right? So both ways, although the rural incomes tend to be lower than urban incomes on average, but because agriculture is an important fallback for many people, some basic food security as far as cereals and so forth go, or even vegetables. Many people grow vegetables just enough for family consumption and so forth. In the urban areas, that's not there. So what you find in these Hunger Watch surveys and so forth is that the kinds of things that people first cut back on are leafy vegetables, eggs, meat, things like that, which and then they fall back just to cereals, right? So if you look at the food security from not just from a very basic calorific angle, but a more nutritional angle, then PDS also doesn't help, because PDS is giving you cereals, which is really what most of the time you're doing anyway, right? So the ideal situation here is that PDS is actually meeting your full cereals quota, freeing up your whatever meager food budget is there for the other more nutritional items. Now, we don't have enough granular data to say if that actually happens or not. But that's one way to think of this. What we can do through PDS is to alleviate the cereals constraint, so that people are not forced to cut back on vitamin and micronutrient rich foods, which are going to give you a lot of nutritional problems later on, even if the calorie needs are met.
Got it. But put it other way, can PDS also, is this policy prescription also valid, or rational or feasible, that PDS can be expanded to non-carb items, like proteinous items or vitaminous foods?
Yeah, absolutely. I think there's a very strong case to be made for that, and that's a long-standing case from before the crisis, that PDS should have pulses. As you know, pulses were also part of the package, PMGKY, but there has been some problems delivering them because they're not usual part of PDS also. So when you think of additions, then they don't always carry through as well. So whether it is pulses, whether it is better cereals like millets, other sources of protein, I think we can think of many of these options through PDS.
Before COVID also, India experienced a slowdown in the economic activity, and now it's COVID. So in these 3 years, what is one quick takeaway or two quick takeaways that you can give? That how did you see the working India or the India's labor market changing in 3 years?
So we had some brief glimmer of hope between 17, 18 and 18, 19 in terms of an employment recovery coming on the back of very weak employment performance before that. So the total size of the workforce had expanded. Women's labor force participation rate actually had increased by a tiny amount, not very much, but a tiny amount. And how much of that was distress, can't really say, but there was some amount of employment recovery happening. However, at the same time, the slowdown started, the pre-COVID slowdown. So before going into COVID, we had some legacy problems of
Mhm.
weak employment generation. On top of that, the 2019 slowdown,
Mhm.
a lack of recovery from demonetization and GST for the MSME sector, and the twin balance sheet crisis with the credit markets not functioning well. So we went into COVID with a lot of structural weaknesses, and we do a little bit of that in the report, but not much. So there's a lot of work to do ahead once the immediate crisis is over.
So I was going to say that it reminds me of something that Amit said in one of our meetings as we were writing the recent SWI, which was this point about, I think 2 years back when we were writing SWI 2019, we never thought that an urban employment guarantee scheme would come into the public discourse to the extent that it has now. And so that's something that we didn't think. And in the during the pandemic, we have states, quite a few states actually experimenting with something like that. So yeah, hopefully this will set the ground for a more long run urban employment scheme. So there are things that we are in policy now which may be the buds for green shoots green shoots for some better policies into the future. Let's hope for that.
Yeah, and I also during the elections that just got over Tamil Nadu, I was looking at their discourse. Both the parties, the both leading parties, had announced quite a substantial cash transfer in their manifestos. Both the ADMK as well as
Yeah.
DMK had announced, I think, 1,000 or 1,500 rupees a month to every household, which turns out to about 12,000 to 18,000 rupees a year, which is quite substantial. I don't know if they'll deliver on that quickly, but I think it has at least come to the public discourse now. Parties which are leaders, in terms of social welfare, say, southern parties are kind of better in that respect. They are talking about this. So, do you think it will translate into a contagion effect, or domino effect, and slowly it will engulf other states? This policy prescription of cash transfers, will that gain traction in India?
I'd like to be optimistic and say yes. I mean, just the politics of it can help make this something more universal. But I think there's also an increasing recognition on the role of the state and the state having to intervene, not just as a sort of immediate response to the crisis, but also that state has a role, and there is a value to having a public health institutions, to having public education institutions. There is a long term as well as an immediate benefit to investing in these kind of infrastructures. And it's not that we can rely entirely on the private for these kind of services. I think that's something that I'm hoping that it's a lesson that we've learned and we can build on when we frame policies into the future. Maybe I'm being overly optimistic, but yeah.
Yeah, no, I think I really very strongly agree with this. That um, we've really seen the limits of private action, right? And when something like this happens, admittedly, this is not a very frequent occurrence, and one hopes it is not a very frequent occurrence. But still, when it happens, it's sort of like black swan kind of thing. And when it happens, it's huge. And if you have underinvested in public goods prior to it, there's nothing but tragedy waiting for you, and that's what we are seeing. I mean, right now, one is just afraid to open the newspaper of the day, and the tragedy is that it is avoidable. So much of this is because of prior lack of taking it seriously, taking the role of the government seriously. We've gone drawn into these fashionable kind of things of small government and all of that so much that we've forgotten that a lot of the places where that comes from have already invested massively in public infrastructure and are sitting on top of huge huge public goods, which they can then just leverage whenever they want. And it's really toxic when that kind of discourse comes from places which are already so rich in public goods, and we get fooled into thinking, oh yeah, right, that it must be right, we shouldn't be investing in all of
Yeah.
this. So it's a big tragedy when we have to pay for it in this way.
The National Health Service in the UK is, I think, a bigger universe of public health, and it's also a big employment generator. So in India, do we need something like the National Health Service where people come on board as public servants, as doctors, as clinicians, and that is expanded to each and every district. I mean, do we need something like that? And Ayushman Bharat, I think, is something very limited, and this is something very broad. What do you think?
No, absolutely. I mean, I think that's, neither of us is really health economists, so I don't know if I can speak much. I mean, Rosa has more different views. She's also coming from a state where there is such things, so she may have personal experience as well, in addition to having an expert opinion. But, there's well understood problems of private markets when it comes to healthcare. And we've known this since Kenneth Arrow's, if we needed that kind of, thing. And it's you don't have to go to the UK. My mother is fond of telling me the story of when she and her friends had gone on holiday to some, maybe it's Thailand or one of these Southeast Asian countries, and her friend had a medical emergency. These are all older women, with pre-existing conditions and so forth, and they're traveling, and they had to go to the emergency room and get medical attention and so forth. And they just couldn't get over the fact that from beginning to end, they didn't have to open their wallets at all. They were tourists in this country, and nobody ever asked anything about money. They could just go and get treated and come back. What we did in our State of Working India 2019, Rosa was centrally involved in that particular thing, which the Universal Basic Services chapter, was we tried to look at state level variations and say, okay, if we give examples from Thailand or Vietnam, whatever, people switch off and say, that's not us. But, you give examples from not even Kerala, go to some other states, which people will think, okay, this is doable. Right. So we looked at that, and we sure enough found that if you invest well in public health, then out-of-pocket expenditures are low, right? And other kinds of indicators are good. So, and this is within country variation. We are not even going anywhere else.
Right. Thank you for making time for this.
Thank you.
Thank you.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.